Hi, good afternoon or good morning, everyone, depending if you're joining us from the West Coast. We're happy to see you here with us today. I see more individuals joining us. I'd like to welcome everyone to today's webinar, Telebehavioral Health Services. Next slide, please. So again, this is our webinar series on telebehavioral health services, planning and investing for your future services. This is session 3, a return on investment for telebehavioral health and digital mental health services. This webinar is sponsored by the Northeastern Caribbean Mental Health Technology Transfer Center, housed at Rutgers in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kathy Rivera, and I'm the project coordinator of this center. So I'll be introducing our speaker today. Next slide, please. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. Please visit the MHTTC Network website for additional information at mhttcnetwork.org. Next slide, please. If you're interested in staying up to date with the events and products the Northeast and Caribbean MHTTC is providing, please sign up to receive our email communications. You can sign up at the bit.ly link provided on the screen. Following the webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform future activities. The surveys are also important because our continued funding is linked to the completion of these surveys, so we thank you in advance for your feedback. We also want to let you know that this webinar is being recorded and will be posted to our website along with the PowerPoint slides in the next couple of days. This presentation was prepared for the Northeast and Caribbean Mental Health Technology Transfer Center under a cooperative agreement from the Substance Abuse and Mental Health Services Administration. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. Please do not reproduce or distribute this presentation for a fee without specific written authorization from the Northeast and Caribbean Mental Health Technology Transfer Center. At the time of this presentation, Tom Codier served as Acting Assistant Secretary for Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions described in this presentation is intended or should be inferred. We encourage you to interact with our presenters during the webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A time towards the end of the presentation. During the webinar, our presenter may pose questions to you, so please use the chat feature to answer those questions. Next slide. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. This includes language that is strength-based and hopeful, language that is inclusive and accepting of diverse cultures, genders, and perspectives, as well as experiences, language that is healing-centered and trauma-responsive, language that invites individuals to participate in their own recovery journey, language that is person-first and free of labels, language that is non-judgmental and avoids assumptions, language that is respectful, clear, and understandable and consistent with our actions, policies, and products. Now let's begin our webinar. We have Jay Ostrowski with us today. Jay is the CEO of Behavioral Health Innovation, where he develops and deploys Telemental Health, Telebehavioral Health, and Telemet programs and designs HIPAA secure software applications such as Adaptive Health, Telehealth. He also serves as a telehealth consultant and implementation partner for the Mid-Atlantic Telehealth Resource Center and is the director of the Telebehavioral Health Center of Excellence. So now we'll turn it over to Jay. And again, I just want to extend a warm welcome to you all.
Thank you all. I wanted to stop sharing my slides and put them in the right right mode. I am grateful to be here. I have done this webinar a couple different ways, a couple different times, and I want to make sure that we're putting this in the best light for you. So I want to ask you guys a couple questions to make sure that we're making sure that you are able to get the most out of this. So sorry, can you see my screen now, Cuddy?
Yes, it's perfect.
So again, my name is Jay Ostrowski, and I work in several different roles. I've been working in telehealth for almost 20 years now. So my first client through telehealth literally almost 20 years ago, and got very excited about it, and have spent kind of a whole career basically trying to make this have a good return on investment, because I love helping people that can't get help. And this has been a vehicle where I could do that. So I've been deeply invested in this exact topic, and it can be kind of complicated. So what I'm going to try to do is boil it down to some kind of key points and essentials for you, and go from there. I wear several different hats. I am a licensed counselor and licensed supervisor, and I have a consulting company for telehealth, behavioral health innovation, and a software company, Adaptive Telehealth. And then I work as a consultant for the Mid-Atlantic Telehealth Resource Center, where we develop the Telebehavioral Health Center of Excellence, and lots of resources on there. So one of the beginning and end slides have the link to that place, and you'll have that as a resource. I'm also available for grant funded consulting sponsored by the Office for the Advancement of Telehealth. And you can reach me again through that matrix site. So a couple things I want to go over today to help you guys get that ROI if you're chasing that with me is what are reimbursable services? Kind of what are the issues around that? We want to talk about the opportunities for profitability, and we want to talk about the challenges as well. So we're going to do some good news, and then some bad news. Also, we're going to talk about what are the ingredients, the essential ingredients to creating the ROI. This could be an all-day webinar, so we're going to crunch a lot of things together. And as all my webinars, we're going to go really fast and go through a lot of content, because I want to give you guys a lot of value. So I would like you to put in chat for me, if you would, where you are coming from. Like, where are you wanting to provide your telehealth services? Are you wanting to do this inpatient or outpatient? And what setting are you trying to do this through? Through a community service board, mental health clinic, a hospital, academic setting, private clinic, primary care, prison? Are you trying to do like a national online network or something else? If you would, again, put that in there in the chat for me, I can, again, start tailoring this. So I'm going to expect you guys to do that for a few seconds while I continue with the slides here. So the big question that we need to be asking as we go through this is, why do some companies have a positive ROI, return on investment, and why do some not? So why is it that some can pull this off and some cannot pull this off? That's kind of the golden question to ask, because there are some people that get a very positive return in growing, scaling their programs, and some that are not. And it would be interesting to learn about what makes that work. So if you read the literature, there's not a lot of great literature on return on investment. There are a few tools, and I'll explain those to you and help you with that. But for the most part, we're lacking a lot of information. So I will give you some data from different researches, citations, and then also just a lot of consulting data from our experiences, me and my colleagues, of what works and doesn't work. So a couple level setting questions to put out there and really create some context for this the whole thing is, what is telemental health and what is telebehavioral health? Kind of how are they the same and different? And a big question a lot of people have is, will telemental health or telebehavioral health last beyond COVID-19 pandemic? We want to figure that out. So we want to answer some of these questions really specifically, and then I'm hoping this will put some context. As you look through some trend data, I think it's going to be really important for you to see the big picture and why I think it's worth pursuing. So telemental health is in context with overall telehealth. On the left side, you see a lot of different terms here. that are more related to the ambulatory setting. On the right-hand side in the blue is the categories we're going to be talking about today: telebehavioral health, telepsych, telemental health. Clinical apps will go in there. We're going to go a little bit into digital health, and then case management. So these are all, or most of them are reimbursable services that we want to use and talk about today. And how do we get the most out of this and make sure that we get funded? So some of us have grant funding. I see somebody put that there. Thank you. And some of us are fee for service, and some of us are going to be watching that are from more an ACO or capitated agreement cost sharing paradigm. I will tell you that the quick news is a cost sharing paradigm. Telehealth is a no-brainer. It saves so many operational costs, and I would argue that for fee for service, it also creates a lot of value and saves on operational costs depending on the setup, and we'll get into that in a minute. So what are we talking about when we talk about telemental health or telebehavioral health? So I did the first research paper on the terms for telemental health. And back in 2015, I found 26 different terms used by license boards, 26 different terms used by counselors, social workers, psychologists for telemental health. So every license board has their own terms. It makes it hard to find this, but what it tells me is that there's a big scope here. And almost 7 years later, I'm up to 46 different terms. So there's a lot that we could unpack, but what I tend to do is put these into 4 buckets. If you haven't watched my other webinars, quickly go over this. So the things that are text-based, things that you type into your computer. So this is live chat. These are forums. These are like clinical things that are all things you're filling in, forms. This next one are apps, or CCBT, which is computerized cognitive behavioral therapy. And that's something you can assign to a client or patient. And I'm going to interchange those words, by the way. Client and patient, I'm going to mean the same thing, but per your setting, it's going to mean different things, right? And those can be like self-help books that we basically assign to our clientele, and they fill these in, and then we review them and help them apply those materials. So that's kind of the self-help on your own apps. And then video, which everybody's familiar with now. So video is kind of the mainstay of telemental health, telebehavioral health. And that's growing in both group and individual counseling, and reimbursement is actually growing as well. And then the third bucket, which is really more on the cutting edge, is the virtual reality bucket, and more avatar based. We had Second Life many years ago come out, the kind of video game, and now we're actually applying that more to different therapy approaches. The DoD and VA have done a lot of work with recreating Kandahar and other trauma locations, and working through PTSD through exposure therapy, things like that. So these are the 4 big buckets. The short capsulated view of all this is video is the most reimbursed. Apps and text-based are great, and they all of these have research backing, evidence-based, by the way, to various degrees. But the text-based and the apps are going to be better for your capitated environment or your grant-funded environment to really lower your operational costs and really increase the value to the end users, and their overall outcomes will be much higher when you're using these in conjunction with video therapy. I would say they're not replacements for, but together they go together quite well. And well, we could talk more about that in a few minutes. But by far the most widely used telebehavioral health is through clinical video, and that's basically seeing on screen at the same time synchronously 2 people. That's what's required to be paid for that service. And this could be, again, individuals, or it could be a group. So I've run DWI groups. I've run group therapy for adolescents, group therapy for women, group therapy for counselors, all through video. And it's a quite nice venue, and we support many of those through the software as well. Another thing to consider is doing things in combination. And I think that's actually where you get the most value, is when you have say a platform that will secure several of these in a secure environment at once. So you can have messaging for different logistical things, and scheduling, even self-scheduling for clients. You can have SMS reminders of appointments and motivational sayings and messages, also in the kind of a standalone app. These things can be put together into one experience that makes a workflow more efficient and, in my view, effective. And then some of these are topical as well, where you can assign those topics and really get in between session value through tracking goals and tracking behaviors, analyzing them with the client and having them kind of read and watch videos on topics and then discuss application in your clinical time. That, in my view as a counselor, that's the most effective use of these things together. So I say that because our return on investment will be tied to kind of which service you do and of the overall value and how you're measuring value. So I want to show just a couple of highlights on trends quickly. 93% of American adults use the internet now. It's important to level set that we have very few people now in the US that are of any age that don't use the internet. So I think basically we can say most American adults are candidates for therapy, and even children and adolescents for telemental health as well. Telehealth exploded, of course, at the beginning of COVID, as many providers kind of scrambled to use something. Novant Health there in the corner is my healthcare system here in North Carolina. And they went from 200 visits a week to 12,000 visits a week. And this is both ambulatory and mental health. The mental health has been growing for many years now, actually. It's been growing in the VA quite a lot. There are like, I think 4 or 5 million visits now that they've done over time and growing, and putting an extra $1 billion in their budget for several years in a row. But then we saw that there are different investments that kind of went back and forth. And these headlines, as you read about them, these are venture capital investments. And it's a mixed bag there. These are the people that are betting on different technologies for the future. And so some people kind of went in early and they saw the prices go up, and then they sold and got out quickly. Some are staying in the long term. So I would just say that future trending, I wouldn't look so much at stock market, because on the ground, things are looking much more positive. Telehealth visits, this is a chart of ambulatory visits. We don't have data on mental health visits for this, but they went way up as a percentage of overall visits. And then they kind of tapered out recently in June. But I think they're going to hover probably around that 10% of, this is again ambulatory. I think for mental health visits, arguably much higher, because it's much easier for us to do all of our services through video. A couple interesting things I think for you guys to know about too is that employers are investing in mental health services by quite a lot. So if you look on the far right, 63% are investing in COVID risk assessments, while on the other side, mental health and telemedicine, stress management are all very highly engaged from an employer perspective. They're looking at how do we help our staff. And with that, we find that 85% of firms with over 50 people in them are offering telemedicine through their health plan. So that means, United Healthcare did this a few years ago, offering it to, through all their programs. Some of them, it's a different level of service. I know through Optum as well. I spoke to a buying group a few years ago, and they were asking me, is this a thing? Should we require this of our vendors? Like Cigna and Aetna, Blue Cross Blue Shield, United Healthcare, and I said absolutely. I did similar ROI talk and trend data to them, and I think they pushed the healthcare insurers to offer that. So that means we need you all, the providers, to participate with your health plans as a provider using secure systems, and we'll go into that as well. Another kind of data point from a different angle, this is healthcare executives for hospital systems. And all of them are investing in telemedicine in different ways. Some of them are doing it niche, some of them are doing it across the board, but all of them are doing something. And their reasoning is greater access to care and chronic care management, which we'll come back to, and that kind of model of care anytime, anywhere. And basically, work-life balance for physicians, improving the market share, lowering costs of delivery, and improve patient outcomes. There's many good things that they're seeing as data points for where you can get an ROI. So for us, I think we can apply that quite easily to mental health as well, in many ways. So again, to level set, return on investment, just for those that are allergic to math, it's basically what's the return that you get, the return that you're trying to get divided by your investment. So how much are you investing, and then how do you measure and what are you getting out of the service? You want to make sure that you're at least breaking even on your services. But in many cases, people are getting many multiples of their money back through the investment. But a lot of it depends on how you're measuring it. So tracking the ROI has been actually kind of tricky for some. I was very surprised at the study a few years ago that showed that only 46% of healthcare organizations even track their telehealth ROI. I was just surprised that they'd be investing in working a lot and not measuring those outcomes, but that's unfortunately quite common. But we found that of those that do, 71% achieved an annual ROI or return on investment, and about 30% achieved 20% or more. Now, most of these entities are hospital systems that have lots and lots of overhead. So I'm expecting that for us in telemental health, it's quite much higher. I know me personally, I used to have 4 locations, 30 WT staff. I also ran a 28 clinic network with several hundred therapists. When we started moving into telemental health, we were able to expand the network, expand the number of clients seen without expanding our costs for, well, the costs were fractional for software, but not for office space and all the costs associated with office space. So I think it's kind of a no-brainer in some respects, but there are a lot of extra things that we need to talk about, and that's what we're going to be going into here in a moment. Another interesting stat I thought for our discussion here is that the percentage of patient population that said they'll continue with telemedicine after the visit, and this is overall, all of telemedicine, of course, and again, surprising, 42% of these organizations said they didn't know if their clients would be continuing, but 50% more said, yes. So I think there's kind of a mixed bag here. And I think a lot of that has to do with the types of services offered and the training experience and the expense of those offered. So if it's done well, telehealth can be very good for both the clinician and the client. It can save money and it can actually make significant money as well. So calculating revenue ROI, we need to think about this from a couple angles, and I apologize for going quickly. I want to get through these and make sure we have time for questions. There are several ways to consider revenue. So revenue could be just doing exactly what you're doing now and getting paid for it through insurances. So most insurances are paying for telemental health. CMS and so Medicaid, Medicare are also paying for it. We're going to talk a little bit more about those codes in a few minutes. But so doing just what you're doing, I think there's a pretty good case to be made that if you were eliminated your office space and we're doing this online 100%, you would have saved those costs of an office space. Now, there are different benefits to an office space as well. And what I would advocate for is doing a hybrid approach of office and online, where you have kind of some concrete infrastructure and expand your network and your services online, which means you start to weave in your services through both in person and online to offer this at a wider geographic area, right? So if you're in North Carolina like me, I can offer services in Raleigh across the state, or up in the mountains, or at the beach, Wilmington, or any of the rural areas. When I worked in South Carolina, people would drive an hour and a half each way to see me quite often. About a third of our clients would do that. So people are willing to come to therapy, and I think I found even more willing to come if it's more convenient online. In fact, there's a lower no-show rate that happens through telemental health. Part of that, I think, is a convenience factor. Part of that is the reminder systems that we've embedded as well. In addition, if you have a clinic and you don't need more office space, you can grow your network of capacity much faster. I used to say we always have one of 3 problems. We either have not enough clients, not enough counselors, or not enough space, right? With this paradigm, we would only have 2 potential problems, which is not enough clients or not enough counselors. So we eliminate the space problem through using online venues. However, that comes with some different management issues that are for a different webinar, frankly. But we can still manage the people remotely. There are just different ways we do it. But again, the benefit here is you can increase your revenue by increasing your scope of of providers and the volume of providers. Also, the types of services that you want to provide to people. So maybe you have in the past, you've wanted to start an adolescent group for drug and alcohol, but you didn't have a substance abuse provider locally in your group, or you didn't have one that was an adolescent specialist. With this, you can have someone that lives way out at the beach be your provider. So your local problem is solved by having people with expertise from anywhere in the state or even in other states if they're licensed where your clients are located. You can also expand into other states if as long as you have a provider that's licensed there. So there are lots of kind of good ways to grow these services, and even more specialized and niche services, because you can draw patients from a larger pool area. And that takes some marketing and again, some logistics work, but it's definitely possible. The other part is kind of your downstream services. If you're part of a larger network or a hospital system, you have referrals to other clinicians in your group, maybe for medication or case management or other services. You can also do remote drug screening and remote breathalyzers, other things like that. Some of that revenue is more difficult to get, but can be captured through some of these remote means, through some different logistics. But again, you might get a trade-off where there's some revenue that's lopped off because you don't have them there in the clinic to capture that efficiently every time. So those are some of the downsides as well. There are more. I'm just for time going to kind of move on. So this is the revenue part. If you think of the actually cash coming in, but there is another part that we'll talk about in terms of value. When we're talking about reimbursement, I'm thinking again of that initial appointment, the additional appointments after that. Some of this is, I think, I found personally easier logistically to see clients because I don't have to prepare my office or greet people or come in and out. Getting people to leave on time is a lot easier actually through Telemental Health. So I'm on online for most of the day doing these services and can be quite efficient. I also can provide different varieties of services, 30-minute appointments and 15-minute appointments that can have higher percentage back to me that are easier to do. There are also some different, you can associate with a psychiatrist and do psychiatry. Chronic care management for behavioral health is actually growing quite rapidly. And the federal government really wants us to be there because it reduces overall costs of care for those clients. There's also some chronic case management for people that are incarcerated, they're coming out, or juvenile, people that are in the juvenile system. So there are lots of different systems that are kind of easier to do this way because we don't have the travel issues or logistic issues with parents or like DUI where they take their license away, would expect them to go to treatment. So there are quite a lot of things you can do there. Also, you can do IOP at a distance. So you can have your in-person IOP services and have on video at the same time, people remoting in on video from their homes all over the state. So that's one way where you can have the same costs of your provision, but your service level is, you're seeing a higher volume of people at the same time. So you have less cost and higher revenue for those services. So those are things that are being reimbursed by like Cigna and other healthcare systems or insurance systems. So a little bit about reimbursement types. So of course, we have our public payers, Medicaid, Medicare, and we have found that CMS has a 2021 line items that are all about telehealth. It's important to understand that Medicare's regulations and Medicaid's might be a little bit different for the state, but typically Medicaid will follow Medicare, as we know. There's also some telepsychiatry calculators out there that if you want to Google that, or I can give you some links to those by some vendors. So you don't have to buy their stuff, but you can use their calculator, of course. But there are a number of reimbursable codes now. They had 144 codes. Let me go to this next slide. Because of COVID, they temporarily added 144 telehealth service codes. And most recently just permanently added group psychotherapy, some home visits for established patients, and care planning services as permanent telehealth Medicare payments. So if you're working with like nursing homes or with older adults, these are great to put in there, and it's a good business to get into because it's growing population, as we know, and it's also logistically easier once you get past the initial tech hurdle of someone older, and that hurdle can be overcome by software and other procedural means that we'll get into. But it's important to know the difference between coverage and reimbursement. So if you've dabbled in insurance reimbursement and you're thinking about going to other things, just realize that those words are a little bit different and have very different meanings. So coverage is determined by your local or your national policies of the private and public payers. So you might hear of them talking about the ICD-10 codes, the CP codes that are covered. CPT codes that are covered, and what they'll pay for, but they also need to be paired with what are they actually reimbursing for. So even though it's covered, it may not be reimbursed at the rate that's acceptable to you. So that's some of the insurance games that we're all, most of us are pretty familiar with. So just realize that the factors for reimbursement might have to do more with who is doing the service, where it's being done, and what are your actual costs. It's the cost sharing model. And are you charging or monitoring for different support levels? For telemental health, you can charge for like a location kind of technical fee. And so that's kind of a site, a site code. So there's a provider side, and then there's the location side. So you can charge a fee for both sides. Of course, the location fee is between $15 and $25 is not a lot, but it's enough to pay for somebody and a little bit more for someone just to facilitate somebody at a office far away. And like for say at a nursing home, they could facilitate those visits for you and get that side of the fee. And that kind of is a win-win for everybody. So calculating your ROI, the other side of the equation, as I mentioned before, the first side being revenue, the second part is value. So there are lots of value that can come from doing this that are not easily captured. There are some accountants and bean counters that have come up with some clever ways to do this. Basically, I think the rule of thumb or the easy way to do it is to say, what's the cost of the problem that you're having right now? So if you're having to recruit more people, or people keep moving away, or you're losing revenue because you can't get people to join with your group or get them to relocate near you, then this is, to me, a very easy calculation because just by having services available online, you are able to plug and play different providers in different areas that can service your new client load. So if you have access to a client load, there are providers that would love to have this recurring set of revenue from you. So they would like to have a steady place where they could log in every day and just see clients, and you being the kind of the broker in a sense, where you're doing all the administration and marketing and kind of project management of a practice, and they just arrive and do the visit part. To me, I found that that's the best way to go, because a lot of people go into private practice and really struggle with the business parts. And some of us business people are really good at getting the clients, but then we can't see them all by ourselves. So we really need to have that network. So I think that's a really good model. And we have I can give you many examples of some that are doing great. So this is the value side. Think of it this way, though. Some of the value in actually direct cost savings are in workflow. So having things automated for you, having reminders automated, having phone calls, paperwork, getting patients prompted to get data from them, getting your quality measures, getting your the patient data typed in for you by a referral source or by the client themselves. Checking it, reviewing it is much faster than doing the typing. But a lot of that ROI could come from integration with your current system. So you'd want to find a software that can integrate and port the data from there to your system, or get a different system that has all these things embedded together. The other part of the value is you might be in line to trade systems. Maybe you have an outdated system that you don't know what you don't know, right? You don't know that you could automate quite a few things, and maybe you don't eliminate a job, but you could reallocate a person to do a higher level work. So in my view, if a robot or a computer can do the work, it should do the work, because there's so much that only a human can do. So a lot of our patient work and our satisfaction work, our logistical work, problem solving, overseeing, it's not something a robot can do, or software. So I think we should look at every possible way we can automate things. And that's where a lot of value comes in. They're also more reliable than us people. So we have fewer errors and mistakes. So from client finding, selecting a provider, all the way through scheduling, filling out intake paper, and even filing of insurance, all this stuff can become automated. The sharing of the video links, all that can be done without another human involved. So you might already have a lot of that in place, or some of that in place, or none of that in place. But the cost and your return on investment for doing that, there's a lot of value to be found there. So consider that pretty strongly. For hospital systems, it's going to be reduced readmissions are the big ticket item that's very easy. Research has found that if we follow up with patients within a week, there's a dramatic drop in readmissions, and then different variations of that. Also, if you're doing telemedicine, you're more able to receive grant money. So every new Health and Human Services grant that's being issued is required to have a telemedicine component to it. That started a few years ago. So every new grant is required to have that. And what happens is when people start their grants, they're not familiar with how to do telemedicine. So some people kind of try to do it on their own and then do it in a very expensive way. And usually because they're being vendor led, the vendor's there to sell you something, or they're hearing this or that, or just figuring it on their own. But a lot of the value is going to come in eliminating mistakes or reducing or preventing mistakes. And that can be done through some consultation. And we'll come back to consultation in a few minutes. Now, there are some challenges to telemental health, and I want to kind of go over them. And this is not meant to scare you so much as sober you into what those are and help you avoid them and work through them. In a nutshell, it's the reimbursement can be a barrier, and we'll talk about that a little bit. Every state is every reimbursement set is regional, as you all know. You're not going to find insurance companies publishing the rates. They usually don't do that. Every once in a while, they'll publish a rate sheet, but then we find that there are variations with that along the way. Someone will do waivers if there's a shortage or they have a big demand in some area. Other barriers that can be out there are, regulations, HIPAA and others, adoption to technology. The good news is that we've solved basically almost all of these problems have been solved in really clever ways. So as you see these challenges, there are solutions to them all as well. So I will kind of go over the next ones with you to show you what I mean. So here's an example of a survey data of the key scaling challenges that was by that executive group that mentioned that they're the reasons why they're going into telehealth and expanding. A lot of it is the uncertainty around payment. We have gotten more and more of that certainty as COVID has produced these kind of permanent codes now, and more and more insurance companies are covering. There's also regulation for parity that we'll talk about, but a lot of it is that they want to make sure that they're going to get the same reimbursement rate over time. And what we found is that the trend is growing in the direction of paying for these services fully. So this is data from gathered in 2019, published in 2020. And it's really more about, do they see these barriers and where should they put their effort into relieving those barriers? What I see is the key challenges is in which type of service to select and the securing the payment kind of methodology and procedures, because there are quite a few companies that are reimbursing. So what a lot of the arguments are is that not all the services are reimbursed, or not all of them are reimbursed at the same rate. But we're finding that in most of the country, in most of the cases, they are doing it at the same rate as in-person services. And trend is growing that way, that more will do that in the near future. For parity, parity is basically, paying the same amount or covering the same things in person as online. And parity has been an issue for quite a long time. And growing and applied to telehealth, it's become more and more of an issue. Prior to COVID, only 5 states had implemented telehealth parity laws. But as you can see, there's an additional 21 states these darker states now. So the light blue is no parity at all. And then all the other states are showing some kind of variation of parity, where they're showing that they are paying for this at the same rates, or covering the same things that they do for in-person services. I say in-person instead of on face-to-face, because when you see someone's face on video, you're face-to-face. So there is a lot more guidance I can give you. And again, I'm not going to drill down into all the specific codes because this is an overall picture today, but there's quite a lot of data that you can look for, and I can give you more data on your region as well. This is also parity and cost sharing. So the dark blue states have a requirement for parity in the cost pre-pandemic, and then the other ones are showing kind of variations of different requirements that have come along the way. So the orange is they prohibit some of the temporary pandemic stuff, and you can read the slide in more detail. But I would say that there's this trend is growing towards this fairness approach and paying for the same amount as they do in services, because the data is very clear that the efficacy is the same as in-person services. So we are noticing that there's an overall trend of they pay between $60 and $90 an hour for a therapy session, for instance. There's that range depending on who the payer is. It's Molina or Blue Cross or whoever it is. So of course, that's different for the provider and the region and the type of service. So you have to check locally, hyper locally, to know what's reimbursed in your area for your services. But I wanted to share the trend is going in the right direction. So the one is figuring out those reimbursements is that challenge, but I think it's easily addressed. Now, the next one is just compliance, right? So this is the where someone kind of holds their head and says, oh my gosh, HIPAA is much more important in the digital space. And I've done a few webinars on that. You can Google that, or I can send you more information on how to do that. I have a HIPAA compliance roadmap that'll give you some really clear direction on exactly how to get compliant with HIPAA. A lot of that's going to depend on the software that you select. There's a lot of warnings I give about vendors. I'm a telehealth vendor myself, full disclosure, but there are a lot of vendors that are kind of fast and loose with HIPAA. And so you want to really dig into how compliant are they and not just take your word for it. So you need some kind of proof, but having that proof from them and getting a software that does all that you need to do will give you that security that you're covering a lot of it. But no software on its own can be HIPAA compliant. So it takes a covered entity, which is you. And as a covered entity, there are certain things that only you can do and the software can't do for you and the vendor can't do for you. So it's important to know what those are specifically and make sure you're nailing those down really, really well. And then also, even though you're delegating it to a vendor, you need to audit the vendor and make sure that they are doing that for you, because if something goes wrong, it's still your business and your head on the plate, and your reputation to be lost, and the fines will go to you in addition to them if they sign the business associate agreement that has those clauses. So HIPAA is a pretty big deal. And again, there's more information on that. But how you go about complying with HIPAA is a really important part of your ROI, because there are some people that are using software that's pretty clunky, or they have workflows that are pretty clunky, and or they're just skipping and more at risk for the company. They're skipping the protocols. So you do need to go by best practices, and I'll share a slide on those in a minute. The best practices and HIPAA compliance and licensure laws all come together to form that kind of network of regulations. And then whatever payment regulations or payment requirements are there, you want to mesh those all together and make sure that you have those as your kind of criteria. Before you go shopping for a vendor, you should have that list in place and ask the questions, what are the workflows we're going to make that super efficient and as automated as possible? And if you can do that automation of all these regulations, you'll find that your ROI will go way up, because all your manual labor and all your delayed items will be reduced or eliminated. So to me, this slide and the work that's done through this is where a lot of your ROI will be. Security, you still, in telehealth, you have to have thinking about security in a lot different ways. So you think about security in terms of how you remotely connect to your EMR, how you get informed consents for adolescents or adults, how do you get your general counseling consents filled out. How do you get the data to the right person? In telehealth, the video visit is not as challenging as the data before and after the visit. How do you do that efficiently in a compliant manner? For physician services, many times they're required by their state to have an in-person visit to establish the patient relationship. In some places that's been waived. For telemat, that's also been waived in some cases. So you can do tele-MAT services in conjunction with counseling, and you can book appointments for both of those services for certain types of MAT, and again have all this to have lab work drawn, have labs presented, have the prescription sent, all of this in a HIPAA secure way, either in one or more softwares. Of course, fewer the better. I mentioned the telebehavioral health best practices. These are both for in clinic to clinic and direct to consumer. For direct to consumer, they take a little bit more thought and a little bit more planning, but with some automation and some pre-planning, pre-scripting, these can be done very efficiently. But remember, they're best practices for a reason. Every one of these has stories behind it of things that did not go right because this was not in place. And many states say, have these included directly. So this was aggregated from several best practices lists and from state regulations to be kind of a master list of best practices. So this is both, this will cover many states at once. So this is why we created this one slide. So verifying this information is a little tricky. And if you haven't done some homework on this, I highly recommend getting a hold of the best practices for telemental health a webinar that I've done, or I can send you more information through the matrc.org website. So as one of the costs of and kind of dings to your ROI is if you start your service and you're thinking we've looked at the fees for our service and we know okay, telehealth looks easy, and we think about a couple of workflows, but you didn't know about these logistical items that you also have to do. This is where your labor costs shoot through the roof. And this is the kind of stuff that you want to work on along with the compliance part. These are compliance components as well. If you do these things efficiently, your ROI will stay in place, but these are things that can poke holes in your revenue bucket pretty quickly. So to avoid some unexpected expenses, pick up a copy of this, walk through it, find out logistics of how you're going to do that. Again, I think software is probably the best use for this, like verifying patient's identity and their location at the time of visit, their local emergency services. There are specific consent requirements that each state have in terms of security and telehealth. You need to get those and make sure that those are signed for your telehealth visits. And then also, your state licensure regulations, make sure that you're practicing in your jurisdiction. So some of that can be automated and again, cut down on your manual time. You might want to start out doing a lot of these things manual while you're shopping for software, so you don't have to go out and stick your teeth into a big expensive system. But make sure you get these lined up as part of your workflow, and then look for the software that meets that workflow. Most times, if you talk to a vendor first, they'll kind of steer you in different directions that are maybe not in your best interest. So looking at this, I think you can reduce a lot of pain and hits to your ROI. There are some adoption challenges, and I just want to run through them real quickly. Resistance to change, resistance to new things, and sometimes picking a very expensive system that may not have been necessary for technology. There's some unanticipated costs in the manual workflow and the technology costs that you can kind of look through here, basically overbuying and unexpected fees. And then because technology access problems too, whatever you pick, make sure that you have a software that can be used on a mobile phone, on an iPad, through web browsers, and that also operates on very low bandwidth. So there are clients that struggle with their bandwidth. You can typically go down to about 500 KB and still have a pretty decent video. It won't be high quality, but it'll be enough to do a counseling session quite well. And also think about the integration with your current system. So if the data doesn't flow from your telehealth system to your system, then there's a lot of efficiency and a lot of cost savings you're missing there. So COVID is we thought wrapping up. It's kind of coming back, so it may be here for a while. But I want you to be thinking about, how do I do this post-COVID? I think, and most people agree that telehealth is here to stay, and was here before the pandemic and growing. So how do you now switch to do this sustainably? And that's probably why you're here on this call. I would think about this when you're looking at your ROI. Think about the maturity of your program and make sure that you're measuring your program at like this level 3 or up. So this is a slide from my friend Christian Millister. He and I do different consulting work together in this space. And he kind of came out with this level system of the maturity of your telehealth program. I thought was quite helpful. And a lot of that on this next slide, it has to do with kind of where your services are and in what state that they're in. And you want to measure your ROI at more of that level 3, level 4 approach. Level 4 is kind of optimal, where you should, where your targets should be. But if you're measuring your ROI at 0 or 1 emerging, you're not actually going to get the benefits. So I have put in here a slide and a link to it on my page of a toolkit that will help you kind of think through some of these logistics as well. I hope that will help you. Get a positive ROI is really strategy, having the right team, your needs assessment, IDing very clearly your ROI factors, like what are your specific value goals? How do you quantify that if you can? And again, your reimbursements, get those precisely nailed down. There are extra G codes or 95 codes that you would add to some of your CPT codes or ICD-10 codes when you're turning them in to get paid. And then, what are the license limits and how do you, select for scalability? That's the strategy side. On the implementation side, you really want to look at your workflows and training your team and then supporting them to identify and resolve problems really, really quickly. Think about this in stages. As once you have it up and running, you really want to look at it and stay hyper focused on it to optimize it to as efficient as possible, because that's where your return investment is really looking at that and having frequent measurement feedback loops. So I'm available to you for free. If you want to meet with me and talk about individual questions, I'll be online every other Friday for 2 hours at a time. If you go to the matrc.org website, in the middle of the page, there's a link to that link for that webinar that's live every 2 hours, open office hours, every 2 weeks. Also, the links on here are to my pages if you want to contact me and ask specific questions. I'll stay online as our time is wrapping up to answer a few questions as well. Katty?
Thank you, Jay. So at this time, we welcome all participants to either enter your questions for Jay in the chat box or in the Q&A pod below. And while you enter your questions, I also wanted to mention that we also invite you to complete our short evaluation survey by clicking the link that I had entered in the chat box. And Jay, if you don't mind moving the slide over to the QR code, please.
Sure.
Thank you. So on your screen, you will see our evaluation QR code. And again, we are a SAMHSA funded program. And as part of this training, we are required to submit data related to the quality of this event. So we promise that all the information that you enter is confidential and is not shared. So, or if you have any questions, you are also welcome to email me directly. I will enter my email in the chat box. In case you have any questions or comments. So Jay, I don't see anyone had entered any questions in the chat or in the Q&A pod. Do you want to maybe go, we have about 5 minutes. You want to go maybe over what will be the discussion for next week on session 4 or?
Yeah, we're going to be talking about how do you actually plan this out in the next few weeks? How do you work with your team to kind of move into this space? Because it's difficult if you're new to this to feel competent and project manage this basically. There are some kind of known pitfalls on the human side and then the tech side, and we'll be talking through those on how to prevent that. So I think you'll get a lot of value from that as well.
Thank you. So we do have one question that came in the chat. So we have someone asking, could you talk about how to establish a council location or counseling location?
Yeah, that's a good question. So every state likes to claim ownership of where the patient is located as the jurisdiction. So states say that if the patient is located in Virginia, then counseling is taking place in Virginia. So that means Virginia will apply to that at the time of the session. It's not residency. It's more like a driver's license. If I drive fast, if I have a North Carolina driver's license, but I'm speeding in Virginia, Virginia law will apply. So even though I have my license in another state. So where the patient is located at the time of services is the counseling location.
Thank you. So I don't see any other questions. So again, I want to thank you, Jay, for providing us with this valuable information. We want to thank also our participants for being with us today. Again, we hope you join us next week for session 4. And if you have any questions, please feel free to contact us. And so until then, we hope you continue to stay safe and well.
Thanks for having me, Kathy. I'll see you guys next week.
Take care, Jay. Bye-bye, everyone.